Hello there. How are you? No, I mean really. How are you? How are you doing? Have you gotten headaches from wearing masks all day yet? Well, do you remember to wash your hands and observe social distance? How practical are these guidelines anyway? In the wake of COVID-19, how are you holding up physically, mentally, emotionally, and even financially? Are you working from home? Well, do you have to risk it every day and go to work? Or do you still have a job? What's really going on in your life in the midst of this pandemic? Hello there and welcome to Metropole Debrief. My name is Ndiro Ganga, and on this edition, we discuss the state of the nation. But before we get into the show, let us take you back to where it all began. When Cabinet Secretary Mutahi Kagwe took over the health docket, one of his first statements was the probability of the COVID-19 virus getting into Kenya was not a matter of if, but when. That statement has now come to pass with the confirmation of the first positive test results for COVID-19 in Kenya.
This is a Kenya citizen who traveled back to Nairobi, returning from the United States of America via London, United Kingdom, on the 5th of March 2020. She was confirmed positive by the National Influenza Center Laboratory at the National Public Health Laboratories of the Ministry of Health.
Following the positive confirmation, CS Mutahi has invoked the Public Health Act 2005, which provides the basic safeguards necessary to protect public health through cooperation between the state government, local governments, healthcare providers, and the community. With the government having banned international conferences to reduce the risk of the virus making its way into the country, the government is further banning any local public gathering.
We have suspended all public gatherings, meetings, religious crusades, games, and all events that are of a huge public nature. No more church services can go on, provided that they provide sanitizing and hand washing as people go into the worshiping areas. We have suspended all inter-school events. In other words, school-to-school athletics, school-to-school events, but the schools at this moment remain open.
Towards this end, the BBI rally that was to be held in Nakuru this weekend has been postponed. In a statement released to the media, Nakuru County Governor Lee Kinyanjui has said the county shall not permit any gatherings which will expose the public to or spread of the coronavirus. A number of local sports events will also be put on hold this weekend. In a statement, the Kenya Rugby Union has indicated that the Kenya Cup, Eric Shirley and KRU Championship semi-finals that were planned for this Saturday now stand suspended. The union has further suspended the 2019-2020 season following the Ministry of Health's directive that banned all public gatherings due to coronavirus. The government has equally banned visits to prisons for the next 30 days. Further, sanitation in public transport will be heightened to keep Kenyans safe.
Transport providers are directed to provide hand sanitizers for their clients and regular cleaning of their vehicles. Let me add here that this is something we arrived at in consultation with the public transport people. There was a meeting between the CS for transport. He's going to talk into that about matatus and so on. We are very pleased that they themselves say they are willing to do everything, including putting in their own money to ensure that people traveling in public transport are safe.
In a radical move, the government has also suspended all non-essential travel outside the country, with CS Mutahi categorically stating that there will be no travel to disease epicenters.
We have placed travel restrictions outside the country unless absolutely necessary, and in any event, no travel at all to the areas, to the disease epicenter countries.
CS Mutahi has also urged Kenyans to observe high levels of personal hygiene to contain the spread of the virus. This as he called for calm, urging Kenyans to carry out their businesses as normal.
Wash your hands with soap and water or use alcohol-based hand sanitizers. Maintain a distance of at least 1 meter, about 5 feet, between yourself and anyone who is coughing or sneezing. Persons with a cough or sneeze should stay at home or keep a social distance, but avoid mixing with others in a crowd.
Meanwhile, Kenya's neighbor to the north, Ethiopia, has become the latest African nation to confirm a COVID-19 virus case. According to a report by Al Jazeera, Tekele Umabanti, the mayor of Ethiopia's capital city Addis Ababa, tweeted that a Japanese citizen was found to be positive for this virus. The mayor went on to urge Ethiopians to avoid meeting and hand contact. The latest announcement by Kenya and Ethiopia bring the number of African countries that have confirmed COVID-19 cases to 14. For Metropole TV, I'm Ondero Oganga. Let us briefly jog our memories on the journey the country has been on since the confirmation of the first case. Now, on the 13th of March, Health Cabinet Secretary Mutahi Kagwe took to the media to announce that Kenya had confirmed its first COVID-19 positive case. The patient had traveled into the country from the United States of America through London. Now, by 30th of March, from one case, the number in the country had risen to 42. On the 17th of May, the number of total coronavirus hit 1,000. So from one case on the 13th of March to 1,000 by the end of that month. Now, let's go to as of June 16th, 2020. The total number of confirmed COVID-19 cases in the country stood at 3,860. We went from 1,000 to 3,000 by the month of June. The virus has equally led to fatalities in the country. We know it has been spreading across the country. The numbers keep increasing, but as the numbers go up, then fatalities equally go up. On the 26th of March, President Kenyatta sent out a letter confirming the first coronavirus-related death in the country, sending deepest condolences to the family of the deceased. That was our first death. On the 6th of April, Kenya confirmed the death of its first minor from the virus. Now, this is a child who was 6 years old. Unfortunately, the child had underlying health conditions and died from coronavirus-related complications at the Kenyatta National Hospital. Now, let's fast forward to the 13th of June. The number of coronavirus-related fatalities clocked 100. Remember, on the 26th of March, we had our first one, and then now we have hit 100, and this is on the 13th of June. This is after 4 more patients succumbed to the disease on that day. The coronavirus death toll in the country stood at 105. The country has also had its victories in the fight against COVID-19. So the total number of deaths in the country is 128, and this is as of the 23rd of June 2020. Now, besides the fatalities, we've also been winning the war against COVID-19. On the 1st of April, Kenya's first coronavirus patient, Brenda Cherotich, together with Brian Orinda, who contracted the disease from Brenda, were declared free from the disease after having fully recovered. On June the 7th, 63 patients were released from various facilities across the country, having fully recovered from the virus. Now, on the 10th of June, the country registered its highest number of COVID-19 recoveries, with 175 being discharged from the hospital. Now, moving on, this just means that we are making strides in the fight against COVID-19. And on the 23rd of June, 102 patients discharged, equally another big number, and it brought the total number of recoveries to 1,782 recoveries in the country. Now, When coronavirus broke out, it just broke out in Nairobi, and then Mombasa was the second county to have a case. And immediately, the president rather went on to seize movement of people from these two places. However, how did the disease spread across the country? As I had mentioned earlier, the first case was confirmed in Nairobi, and then Mombasa followed with a case. That was the beginning of the spread of the virus across the country. Now, on the 30th of May, Kericho County confirmed its first infection. On 31st May, Laikipia County equally confirmed its first case, bringing the total number of counties with positive cases to 34 out of the 47 counties. Before this, several counties had recorded cases. For example, Busia County, through truck drivers bringing goods from Uganda and also transporting goods into Uganda from Mombasa. Siaya County, where residents of Kibra went for funeral. Wajir County, where the first case had history of travel from Somalia. That is the current state of the nation with regards to the spread of COVID-19, how the numbers look like so far, how many confirmed cases do we have, how many active cases do we have, recoveries, and unfortunately, fatalities. After the break, no expert, just ordinary Kenyans like you, speaking on their life experience amid COVID-19. How has the disease affected their lives? How is it shaping their decisions, and how are they adjusting? And what future do they foresee for themselves? This and much more after the break.